wondering what were maybe some of the challenges that you encountered when you first started out and that you faced, and how did you overcome them?
Yeah. So for me, the first challenge I faced was understanding a huge matrix organization. And so my response to that was to get out and to meet people where they were. So I went to every single hospital I possibly could reach. The only Cleveland Clinic hospital I haven't been to yet is Abu Dhabi, but I am definitely going to make it there at some point. But
Mhm.
driving across the entire organization, all over the Treasure Coast of Florida, and from Ashtabula County, Ohio to Avon, Ohio, and all the way down to Tuscarawas County, where we have Union Hospital, and spending time because every single hospital was acquired at a different point in the Cleveland Clinic's timeline. So they're all unique. They're all different. They have different makeups and models of staff. Some have many, many employed physicians, and some have only exclusively private physicians who don't have a paycheck coming from the Cleveland Clinic, have a very different business model than our employed physicians do. So, getting into every single hospital and environment of care, walking the halls, talking to patients, talking to nurses, talking to doctors, walking around. And I went out with our environmental services staff. I didn't understand, when I first started, I had a vague understanding of environmental services, but I really didn't know what it meant to be an EVS worker and the role they had to play in patient experience. Well, our EVS workers have a script that they use is they clean the patient's room and they explain every step of the way precisely what they're doing. One thing they realized is that when they go into the bathroom, patients often didn't recognize they were cleaning the bathroom. So they put little, hotel strips across the toilet that indicate that it was cleaned. And they explain to the patient how they clean the bathroom and how important it is to them personally that we're always clean at the Cleveland Clinic. And when they started doing this in a highly reliable way, they saw their EVS scores go through the roof. It's absolutely incredible. So, understanding those intricacies of the different operational units of the hospital and how they work, as well as understanding each individual staff model and hospital set of challenges was really important to me. And I think that's the sort of thing you can extrapolate to any business. Tell me more about my customers. What's important to them? What worries them? How do they function? I think that's the sort of thing. You got to get out there. You can't be behind a Zoom meeting 8 hours a day and expect that that's going to work out for you. You have to actually get out there and walk the halls and figure out what makes these places tick.